Hi, today trending news is an unseen, rapidly spreading biological threat that's actively infiltrating our public food supply, sparking a massive parasitic outbreak across multiple states. Welcome to this Dr. Mac News Special Report Explainer. I'm your host, and what you're about to hear today directly impacts the safety of the fresh food you bring into your own home. We're tracking a sudden and incredibly high-stakes surge in widespread infections. Right now, health authorities are in an absolute race against time to contain a microscopic parasite. It has successfully bypassed routine agricultural safeguards, and it's already left well over 1,000 Americans severely ill. The sheer speed of this outbreak has the public on edge, and it's put federal investigators on high alert. We need to start by looking at the immense, truly unprecedented scale of this ongoing crisis. As we speak, nearly 1,000 people have been officially diagnosed with this parasitic infection in the state of Michigan alone. To put the gravity of that data into perspective, this marks the largest single outbreak of its kind in the state's entire history. It is rapidly becoming one of the most significant national public health events we've recorded in recent years. Now, when we look at the geographic data, the mapping paints a highly concerning picture of the pathogen's trajectory. The caseload right now is heavily concentrated in the Midwest. Michigan is bearing the brunt of the impact with that staggering 1,000 confirmed cases, but Ohio is falling closely behind, reporting over 400 infections. And unfortunately, this pathogen isn't just contained to the Midwestern region anymore. We are now tracking fresh, emerging cases moving steadily eastward. As of the most recent data drop from July 7th, this outbreak has officially crossed regional lines and reached the DMV area. State health departments are now confirming 10 cases in Virginia. Furthermore, a brand new case was just diagnosed in Maryland at a MedStar urgent care facility. This kind of swift cross-country movement really underscores just how highly mobile and how difficult to trace this biological threat truly is within our modern food distribution network. So, let's examine exactly what kind of biological threat is attacking the digestive tracts of these victims. Looking at the clinical data, the illness is defined as Cyclosporiasis. It's caused by Cyclospora, which is a highly resilient, microscopic parasite carried by food and water. And because it is microscopic, the danger is entirely invisible to the naked eye. You literally cannot see it on your food, you can't smell it, and you cannot taste it. The physical realities of this infection are brutal and unforgiving. Patients presenting at urgent care clinics are reporting severe gastrointestinal distress. Symptoms usually begin with intense nausea and abdominal cramping, but they quickly escalate into weeks of unyielding, watery, and in many clinical descriptions, explosive diarrhea. Compounding the danger here is the incubation period. There is a staggering 2 to 14-day delay in the onset of symptoms. That makes it incredibly difficult for victims to link their severe illness back to the specific meal or produce that originally infected them. From a medical standpoint, it is absolutely crucial that we distinguish this outbreak from a standard 24-hour stomach flu. Common viral gastrointestinal bugs are self-limiting, meaning they typically pass on their own without medication. Cyclosporiasis, however, is a parasitic organism that anchors itself firmly within the intestines. For those experiencing these severe symptoms, it absolutely requires targeted medical intervention and a very specific course of prescription antibiotics to eradicate. Which brings us to the most urgent question of this explainer. Where exactly is this parasite coming from? The Centers for Disease Control and Prevention are currently spearheading a massive, multi-state traceback investigation. However, because of that delayed onset of symptoms we just discussed, pinpointing the exact point of origin in our sprawling agricultural supply chain is proving to be an exceptionally complex, time-consuming challenge for federal investigators. Based on historical outbreak data and current transmission patterns, the CDC has isolated a few suspected vectors. They are heavily pointing toward contaminated fresh produce, specifically items like leafy greens, prepackaged salad mixes, and fresh berries, as well as infected agricultural water supplies. Now, I want to be absolutely clear on one objective fact to prevent any public panic. This parasite is not spread person to person. You cannot catch this from simply standing near or touching an infected individual. Since the exact source is still actively circulating in the market, you must intervene at the very end of the supply chain, which is right in your own kitchen. Immediate consumer safety action is required. First, wash all fruits and vegetables thoroughly under running water before consumption, regardless of where they were purchased. Second, monitor yourself and your family closely for any severe gastrointestinal symptoms. And third, if these specific symptoms do arise, do not attempt to wait it out. Contact a healthcare provider immediately. While issuing that guidance, we also have to deliver a stark medical warning. Dr. Miriam Fisher, a senior attending physician at MedStar Health, made it very clear. Washing may not fully remove this parasite, but it helps, it makes a difference, and it's critical. Washing your produce is your primary line of defense right now, but it is not an impenetrable shield. You must remain hyper-aware of what you are consuming and how your body reacts in the days following. The excellent message we must leave you with today is that strict public health vigilance is absolutely required. Do not take shortcuts with your food preparation. We're facing a microscopic threat that has already evaded initial agricultural safeguards to infect thousands of citizens. Your personal awareness, your strict adherence to food safety protocols, and your swift action in seeking medical care are the only ways we can break the chain of this outbreak and protect our communities. We'll continue to meticulously monitor the CDC's ongoing investigation and provide you with immediate updates as the data develops and if new regions are impacted. Until then, protect yourselves, protect your families, and maintain strict food safety standards in your homes. As agricultural supply chains grow more complex, one has to wonder, is this invisible threat a rare anomaly or the new normal for our fresh food? You are watching to the Dr. Mech News. Thanks for the watching.